Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me today is Dr. William Gillespie and nurse practitioner Valerie Brown of Gastroenterology Associates of Columbus. And today we're talking all about a topic, yes, I know you don't want to know about it, and it's called hemorrhoids. Welcome to the show, both of you. How are you?
Doing great.
All right. We're ready to dig deep and talk about what these issues are. Explain to everyone at home, what are hemorrhoids, doctor?
So hemorrhoids are basically just big blood vessels at the end of the colon. Everybody has them. There are some on the inside of the rectum, some on the outside of the rectum, and generally they don't necessarily cause any problems. But if they get irritated and swell up, then you can start having symptoms, and that's when people really start to notice them.
Okay, I don't want to get into the symptom part just yet. It just dawned on me when you said everybody has them. How does that come about? What do we do? Is it like a hernia, like we're lifting something and it just pops? How do we know that pain starts? What causes it?
Well, the blood vessels are just naturally part of our anatomy.
Okay.
But again, they don't really cause any problems unless they swell up. And there's different things that can cause them to swell up or get irritated. Well, the most common thing is constipation or straining.
Right.
It can also happen with lifting and things like that. Women will commonly get them with childbirth and things like that. So there's a lot of different things that can cause them to swell up and get irritated.
Okay. Is it more predominant in men or women?
I would say it's probably a little more predominant in women during those childbearing years.
Yes.
But as men get older, well, as everyone gets older, all of our tissues kind of lose some of their elasticity. And so actually I tend to see patients with hemorrhoidal symptoms more so over the age of 65 than I do any population. And it's about 50-50 male-female.
Really? Mm-hmm. Do we need colonoscopies to analyze these hemorrhoids, or is that not necessary?
So it kind of depends. You know, a lot of people we see present with rectal bleeding, and they assume it's their hemorrhoids, and a lot of times they're right. But rectal bleeding can also be a sign of something much worse than hemorrhoids.
Right.
So if you've had a colonoscopy, if you're up to date on your screening, then you don't necessarily need a colonoscopy. But if you have not had a colonoscopy, or if you're due for a colonoscopy and you're having rectal bleeding, then you definitely should have one. And not just assume it's hemorrhoids, because it could be something much worse.
Okay, now there's two types of treatments, right? Surgical and non-surgical. Walk me through both of those, if you wouldn't mind.
Well, our non-surgical treatment that we offer here at the clinic is hemorrhoidal banding.
Right.
And basically what we do with that, there's no cutting required. We go in, and what I tell my patients is it's essentially kind of like a facelift for the colon. We go in and we pull that extra tissue and that hemorrhoid back into an upright position, and that usually alleviates a majority of symptoms. Surgical treatments actually involve going in and making an incision and actually removing the vessel or the vein. And so there's a little bit more of a recovery time when compared to banding. Banding, you know, we usually request about a 24-hour period of time where you just kind of take it easy, whereas with hemorrhoidectomy, you're looking at a pretty extensive recovery time. Most people at least 2 weeks, some people up to 6 weeks, depending on the extent of their surgery.
Well, I was about to say, but that would be depending on how severe that is. Do we have more than one hemorrhoid at a time, or?
Yes, everybody generally has three.
Oh, really?
Three, and they may not all be irritated, but when we do the banding procedure, generally we try to do 3 sessions so we can get all of the hemorrhoids. So yeah, generally 3, but not everybody needs 3 sessions.
Okay, we often see on TV the advertising for hemorrhoid creams and the cushions. Are they needed before surgery?
They can help with symptoms.
Right.
You know, they don't necessarily, if the hemorrhoids are bad enough, they're not necessarily going to make them go away.
Okay.
But those are good if people are having symptoms like pain or bleeding. Then there's some kind of over-the-counter things that can help.
Appreciate both of you. Always good information. Thank you. If you want to find out more information, there it all is up on the screen. I've been chatting with Dr. William Gillespie and nurse practitioner Valerie Brown of Gastroenterology Associates of Columbus. Back after this short break.